Let's learn about normal labor. A lot of you guys has been asking me for this topic, and yes, here I come with this important topic. If you are medical student and currently you are studying ops and gynecology, and if you are nursing student and if you are in your last year, then labor is a very crucial part to know. So let's define normal labor. Why normal labor? Because labor come up in a two type, normal and abnormal. Normal labor is called as Eutocia. In previous lecture, I explained you before that normal labor is also termed as Eutocia. Okay. Now, how it defined? Here I am using DC Datta. It is a series of events. Why? Because labor is divided in mainly three stages, as labor has four stages, but four stages are observation and three stages is related to physiological process. As labor is a physiological process, you can count in a clinical diagnosis. Some myths and taboos says that labor is a disease or something, but big no. Now, series of events means stages of labor that take place in genital organ. Okay, genital organ means female reproductive system. In an effort, a power which is uterine contraction, cervical effacement, dilatation, first stage, which expel the viable product of conception. Expel out means push out viable products. Viable products means fetus. Viable means living. Okay, fetus, umbilical cord and placenta. And conception means what? Conception means successfully ejaculation of sperm into vagina and then fertilization, implantation occur. So that viable product of conception are expelled out through vagina, okay, vaginal canal with the help of genital organ, okay, from uterus through the vagina. Okay, I already explained you this, into the outer world in external environment, which is called labor. So labor is a series of event, means stages of labor. First stage is related to uterine contraction, cervical effacement and dilatation. Second stage is related to fetal delivery, and third stage is related to delivery of placenta. So these are the series of events that take place in genital organs, female reproductive system, in an effort power to expel out, push out viable means living product of conception, fetus, umbilical cord and placenta out of the womb means birth canal, uterus, through the vagina into external environment, which is called labor. Okay. Okay. Now labor has some criteria. Okay. Which criteria? It should be spontaneous in onset and at term. Okay. When pregnancy as a terminal part, okay, like 9 months are completed, now labor is start. Okay, labor is a physiological phenomena which start after ending, means terminal part of pregnancy. Estimated date of delivery is nearer. Okay, delivery has been expected. Okay, so spontaneous, it should be spontaneous, means happen eventually after pregnancy completed. And at term means the completed 9 months and above the 10 days, 37 to 42 week of gestation, and it days 279 to 289 days. If it happened prior, then it called as mini labor. If expulsion of previable live fetus occurs through the same process but in a miniature form, it is called as mini labor. Why? Because it may occur prior to 37 completed week. Okay. Patient is called as parturient and the process of giving birth is called as parturition. Okay. Second, with vertex presentation. As I explained you before in my lectures, what is vertex? Vertex is topmost part of what? Parietal mons. Okay, with vertex presentation, without undue prolongation, normally first time pregnancy and first time delivery, labor will be completed between 18 to 22 hours. There is no prolongation after that. Natural termination with minimal aid, where like no including forceps, vacuum delivery, big no. Or C-section. If during labor we have to do C-section due to some reason, okay, like spontaneous or aided, or it may be abdominal surgery, then it considered in normal labor. Okay, I said normal labor. But if C-section is planned, okay, then it would be not considered in normal labor. Last, without having any complication affecting the health of mother or baby, like mother and fetus should be what? Healthy. Delivery of newborn baby should be healthy, okay, that considered in a normal labor. So here is a meaning of normal labor. In next lecture we will discuss about abnormal labor, causes of onset of labor, and physiology of labor. Till then, happy learning.